Big news on the fight against COVID-19 now. Just a little while ago, the CDC announced that its independent advisory committee will meet in about 2 weeks on boosters for Johnson Johnson and Moderna. The same committee will also meet in early November on Pfizer vaccines for kids 5 to 11. Let's talk more about this. We're going to bring in ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein. John, good to see you. Let's start with the first part of this CDC news regarding vaccine boosters for Johnson Johnson and Moderna. What do you make of it, and how does it affect the fight against COVID to this point?
Yeah, Kira, I think this is amazing news. This is an important step in getting the boosters for those millions of Americans that had the J&J Moderna vaccines. We know that the boosters for Pfizer are available and authorized for those who are immunocompromised, elderly, high risk of severe exposure. And so now what we're seeing is that, gradual progression to those other vaccines. And so we'll have the FDA meeting October 14th and 15th. And then eventually, as we assume authorization will take place, in the hands of CDC to make very similar recommendations. And, this is a key pillar in the response to the pandemic. It recognizes that those who are vaccinated need to continue to be protected. And we know that immunity wanes over time. And so it's great to see, those boosters potentially in the arms of those who got the Moderna and J&J vaccines. And so we'll have to wait and see. But at the same time, we have to remember that this pandemic is still driven by the unvaccinated. And while it's great to see boosters to increase that protection, we've seen data from Israel that there's additional protection that you get from a booster. We know that, the cases that we're seeing in this population are really driven by those who are unvaccinated. And that's why it's the priority of public health to make sure that we are still showing that these vaccines are safe and effective for what matters, severe illness and death. And that's really what will ultimately end this pandemic.
And the same CDC advisory committee also going to meet in November to discuss pediatric COVID vaccinations. So how could this impact kids ages 5 to 11? And would it be the same size dose as adults?
Yeah, so this is really exciting news as well. We have now a timeline to see those vaccines in kids 5 to 11. We know that we have that authorization in 12 to 15 and 16 and older, it's fully approved. And unfortunately, I know that there were many that thought we would get there by Halloween. It's likely going to be a few days after that. But we have to remember that, the FDA has thousands of pages of information review, and then it has to go to the CDC to make specific recommendations. And we want the FDA and CDC to be super deliberate here. Yes, the clinical trials had 1/3 the dose, and that's what we'll likely see authorized. And so it'll be the same timing of 2 doses, but just a smaller amount. But we have to be, excited that we will likely see vaccines available for our kids before Thanksgiving, especially as we're seeing record numbers of cases in kids. So, ultimately, those 28 million kids that potentially could get the vaccine, such a big step in terms of ending this pandemic and ultimately keeping our kids in school and learning, because that's really what we've been trying to get after for the last year. So getting that eligibility is super important. And it's really exciting to see, a timeline for that now.
Absolutely. As a parent, I can second that for sure. Dr. John Brownstein, as always, thank you so much.
Thanks so much, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.